Great, excellent. Well, let's get started. Welcome everyone. Thank you for taking the time to attend today's training. I'm Stephanie Dahlberg, here with the Bureau of Housing Supports over at New Hampshire DHHS. I'm also the co-chair of the Balance of State Continuum of Care for the Event Subcommittee. The Balance of State Continuum of Care is sponsoring and hosting the training series on coordinated intervention, along with the continued communication and collaboration with Greater Nashua and Manchester Continuums of Care. We're here today to receive community-wide training on diversion practices within the coordinated entry system. This training was developed and will be presented by the Technical Assistance Collaborative. Today's training will be an overview of what diversion is and how it plays into coordinated entry. We appreciate you taking the time to be here with us. And I am putting in the chat the login. I'm seeing someone wrote in, it's difficult to hear. I am almost done with the intro, so hopefully you can hear Doug better. And with that, I'll pass it over to Doug and I'll continue sending in the chat. Thank you.
Hey, thank you, Stephanie. And welcome everybody. Let me know, actually, if we can get either some nods, I'll look at the cameras quick, or in the chat if my voice is coming in a little clearer. Folks hear me okay? Thumbs up, so see some nods, thank you. All right, well, I'm gonna assume we're good. So my name is Doug Tatro. I'm with the Technical Assistance Collaborative. A number of you, or most of you, may have been on previous trainings that we've had in these sessions. We appreciate you all coming today for this, I believe, third iteration of these sessions that we've had over the last couple of months. We know, and I appreciate how busy folks are amongst your normal jobs, and now we have Omicron surges, and we have January in New Hampshire, and there's a lot going on. Taking 90 minutes of your day to attend this is difficult. So I really appreciate that. This will be primarily didactic, though we'll have some time for questions in the chat and if folks want to unmute a little bit later. But we are looking to really just provide a general overview and level set of some key concepts related to our topic today. And we are also recording this training, and we'll distribute the slides and the recording link in the next couple of days once those get processed in the Zoom template. So for introductions, please fill out the Google form. The link is being added in the chat. That demonstrates that you have attended this session. You're also welcome and encouraged to use the chat to communicate with me or Stephanie or the other partners from the state or each other throughout the meeting. I will try to find some pause times, certainly at the end, to take a look at what questions may be arising or feedback may be arising as well. So we'll try to keep folks as engaged as we can, and hopefully in the future where I'm involved, be able to have more conversations with you all rather than just hearing Doug talk for a while. So I work for an organization called the Technical Assistance Collaborative. We are a nonprofit organization, but we operate as a consulting and training firm hired by communities and by state and local and federal agencies to support efforts related to homelessness, affordable housing, and people with disabilities. We're based in Boston, but I am New Hampshire born and raised, and I currently live in Manchester. So while I do work in communities across the country, I'm always happy to be able to connect with folks here literally in my neighborhood. So today's topic is called housing problem solving, and we're going to weave together a number of concepts related to kind of that big picture concept as we go along here. But overall, you can see the agenda that we have for today. A brief overview of what housing problem solving is, including some distinctions among key terms and definitions, how problem solving is embedded or can be embedded into coordinated entry processes and systems, and some general practice considerations. Today, this presentation will focus on themes that are constant or sort of universal with sort of any COC or group of folks that are working to end homelessness. But there are going to be over time a lot of, I think, implications and more reinforcement on how these types of practices will be embedded into the three COCs coordinated entry processes and access points within the state of New Hampshire. And there'll be more to come on some of those, and I'll allow others from the state and the COC leads to offer any more on that for today. But we're going to talk about some of these concepts more generally. So let me see if I can. So what I'm going to do is first launch just a very quick poll just to get a sense of the room. And what we're asking you to tell us is, what is your level of comfort with the concept of housing problem solving? Is this something that you're very familiar with? You feel like you could run this training, you're a pro, I could use some practice, I've heard the term, but have a general sense, or this is a brand new term to you. So I've got this open and I'll give folks another 10 seconds or so to respond. You can see that, so I will read the results to you in a moment. So go ahead and fill out that poll. What's your level of familiarity? This is an anonymous poll, so if you are completely unsure of what I'm talking about so far, feel free to indicate so, and no one will know it's you. So we're gonna give it 5 more seconds. 12 folks haven't responded yet.
Okay, I am seeing Ellen mentioned she couldn't see the poll, but it looks like others are seeing it. I'm not sure.
Yeah. There may be another window, Ellen, that opened on your computer.
Those of us that might be on a mobile device, make sure you hit the More button down at the bottom. You'll see a red bubble, and then you can select Poll near the chat option.
We'll just give it another second. This is a good, just a quick indicator. So I'm going to go ahead and close that now. So what do we have? And I'm not sure if you can see this, but of the folks that responded, we've got about 9 of you that feel like you're a pro with this, 16, about 27% that could use some practice, but have you're getting there, you have some ideas on it. Another 40% of you who have a general sense of what the term is, and a few of you, about 15% or 8 folks that don't know what the term is, and that's perfect. So what we're going to try to do is further folks' knowledge that have a sense of what I'm talking about with housing problem solving, and also offer that introductory baseline foundation for those of you who are questioning whether you're in the right training today. But this is a term that is relatively new, and it is intertwined with other terms, which we're going to talk about those distinctions today. So it's an easy thing to need further clarity on. So before we jump in, I want to just remind all of us sort of why we're here. And as we go through the training, you'll see that a lot of what we're going to talk about with problem solving has to do with centering the clients and the human beings that are looking for assistance in empowering those human beings to help us guide their exit or prevent their entry into homelessness. And one of the things that I think we often forget when working with folks for the first time is the sheer amount of stress involved in someone becoming homeless or having a housing crisis. So just for about 30 seconds here, I want everyone on the call, and feel free to close your eyes or go off camera if you'd like. We do this exercise in person, and I always find it to be really valuable. Think about a time in your own life, personal or professional, it could have been yesterday or 10 years ago, that it was a very difficult situation that was really important to you, where you may have felt out of control, and that problem persisted for more than a month or for a prolonged period of time. And think about how you felt and acted during this stressful, difficult situation that you were in either your personal or professional life. And so I'm going to just pause for about 15 seconds and just let folks muddle that in their own minds. You won't need to share out. But think about that. Think about your own life and one of these really difficult situations that you may have faced, and how that made you feel and act in your life. Okay. So one of the things, and this will be your only neuroscience lesson of the day, that we know about stress is that it literally rewires the way in which our brains function. Many of you who participated in that exercise silently probably remember feeling anxious or confused or tired or irritable, or maybe you had a couple of extra glasses of wine that month because of the stress that was on your shoulders, or maybe you were having more difficulty managing relationships at work or with your family, or maybe you were becoming forgetful. those are clear signs of the way in which our brain adjusts, going back to, the very beginning of our human brains in our fight or flight responses. And when we are feeling good, our ability to provide executive function coming out of our prefrontal cortex allows us to navigate the challenges and the options and the potential barriers that we have in our lives with much more finesse and a much more, I'm going to mute somebody, with much more of a sort of coherent strategy. Now, when we are under high levels of stress, particularly when we are under stress for long periods of time, that brain function, those connections that allow us to navigate those things change into other parts of our brain that you can see here. And literally, it makes us less capable or incapable of performing certain functions. The reason this is important is because stress, as we all know from our personal lives, and I'm sure many of you know from your professional life, either internally within your organization and teams or with the clients that you face, directly affects the ability for people to solve problems, to modify behavior, to follow through with plans, to override some of the more impulsive behaviors and emotions that we may have, to set goals and try to actually direct ourselves toward them. The stress of housing crises and homelessness and the prolonged stress of poverty and the other factors that lead to homelessness have that effect not only on us and the folks on this call, many of whom may have had housing insecurity in the past, some of whom may be in poverty or have that now, some of whom have not, but work with clients who have. We have to always be trying to remind ourselves and reinforce to ourselves that the folks that we're working with who are coming in on what is the worst day or week or month of their life have this tremendous amount of stress on their shoulders due to that situation they're in. So as we talk about housing problem solving, one of the rehumanizing aspects of this concept is to work with people to reduce or de-escalate the stress overload that may be in their lives at the time. And we talk about this not only in terms of how we empower people to help us navigate them toward a better housing situation, but also in things like how many of us, including myself, misdiagnose mental health issues with what is really a stress overload symptom, or may bring our unconscious biases into the workplace, or recognizing that there are certain populations such as Black, Indigenous, or people of color, BIPOC, or LGBTQ populations, or young people who are disproportionately affected by trauma, have long-term exposures to stress, and then that manifests into behaviors and actions that may not lead to the results that we all hope. And so as we're going through this very basic foundational workshop or training today for the next hour or so, and as we move forward in these concepts, we always want to reroot ourselves in the human experience of the folks that we're trying to support. And I think it's important we start with that whenever we talk about practices that connect people together. And one of the key features of this housing problem solving practice is being able to de-escalate and rehumanize the connection between folks who are in a crisis and those folks like yourselves who have the capacity to help them navigate away from that crisis. And understanding how those stressful environments play into whether or not somebody is empowered or able to help navigate toward a better solution helps us then respond in a way that doesn't cause further stress, but in fact de-escalates those trigger symptoms and helps people reground in their problem-solving capabilities. So when we talk about housing problem solving, we will talk about this as a system, both a system and practice level response, but it is also a response that tries to work with folks in a way that helps them navigate some of their own housing solutions. So in context, you may have heard all sorts of different terms around housing problem solving, things like prevention and diversion, rapid resolution is a VA term, progressive engagement. We're going to kind of demystify some of these terms, but our concept of housing problem solving really tries to root us in with a blanket sort of set of ideas that then apply to different types of interventions or timeframes for those interventions that we see in our communities. Before we can define that, really important to acknowledge some base realities that we face right now. And we've done this in previous trainings, maybe with other contexts. And this first check mark is one that I brought up a number of times when we talked about coordinated entry a month or two ago, and that right now in every community in this country, and New Hampshire's 3 CoCs are no different, there are more people who need housing assistance than we have housing assistance to provide. Now, we may have in this country all the money we need, and I would argue we do, to invest in systems, in bricks and mortar, in services that can help people end or prevent their homelessness writ large. But right now, your system, the control that we have within our homeless crisis response system, does not have all of the assistance that we have, that we need to provide for anybody seeking that assistance. For those who will become homeless, those who have become homeless, we all know that those lists of folks that we cannot help are often longer than the list of folks that we can help. And so what we want to be able to acknowledge is that part of our job, not only enrolling people in projects and trying to figure out how much rental assistance they need, but really that we need to empower the folks that we're here to support to help us end their homelessness. And sometimes, excuse me, sometimes that comes in ways that have not been as conventional. So I don't believe we're ever going to end homelessness with 1-bedroom and studio apartments. I don't think it's possible. I think that if that is the goal, then we will never achieve that goal. I also believe that reconnection to family and friends and natural support systems is a critical aspect to our work. This is true for people who have mental health challenges, who have substance use disorders, who are homeless and looking for needing assistance and needing that support network. It may not be true that everybody or even most people have those natural or community support systems in place to help them navigate away from a housing crisis and back into more stability. But it is also true that many folks that we work with will not receive any other type of assistance from us. And so we have to look for creative ways to make those reconnections and find ways that we can help people navigate away from that current situation that they're in into something more stable as quickly as we can. And oftentimes we see that services are de-emphasized in sort of deferring to financial assistance. And of course, people need help paying rent. There was a report that just came out last week that further demonstrated that rental markets are tightening and they're getting more expensive. Fewer and fewer people who are considered low or extremely low income or on fixed incomes can afford a 1-bedroom apartment or an SRO on their own. So financial assistance is always important, but the capacity for you all and your teams to provide services that help de-escalate and navigate folks back into some other housing situation is critically important. So we have to be able to emphasize how we balance the need for our budgets and our investments to go toward financial assistance and bricks and mortar, to also being able to be those key linkages for people across different systems and different connections. That said, there will always be people, or there will be for some time, hopefully not always, because our job is to make it so always doesn't happen, but there will be people who will not gain access to housing without deeper support, both in terms of clinical, focused support, as well as deep subsidies that will likely be enduring, long-term, or even permanent. And so within these realities, we recognize that there's a spectrum of outcomes, of inputs, of folk situations that we have to be able to work through if we're going to end homelessness for all folks. With our most, with our deepest subsidies and most intense resources going to those for whom there's no other option or resource that will be available to them. And so what is housing problem solving for the 14% of you who hadn't heard of it before? It is a blanket term, and I'll read this slide. There's some other dense slides that I'm not going to read, but I'm going to read this slide. Strategies and services that assist households to use their strengths, support networks, and community resources to find safe, decent, and appropriate housing as soon as possible outside of the homeless crisis response system, even if temporarily. They should be used with everyone interacting with the homeless service system, often more than once and over time and as conditions change. And it's a core set of strategies that features that can be employed at all different points in our engagement, from your access points for those of you who are doing street outreach or have walk-in centers, to those of you who are trying to coordinate housing plans for recently enrolled rapid rehousing clients to those of you who are supporting people who are prioritized for permanent supportive housing. This is a way of rehumanizing our work and perhaps in some places moving away from some of the old paradigm of how we would work with people in the front end of engagement. Sign these forms, we'll find you a bed, we're going to get your data, to something that actually relies on human creative conversations, interaction, and trust, and works with people to identify solutions that may not be the bread and butter one-bedroom apartment subsidy that many of us strive for and many of us have been successful with for a long time. And recognizing the realities that we had on the previous slide, we know we need other options for folks and other ways to help people navigate. So we focus on empowering, yes.
Sorry, I wasn't sure if you were trying to share your slides yet or not, if you were just doing an intro and then showing your slides. I know you had a few ready for today.
I was, but some.
Here we go.
I apologize for that. So just for folks, and I don't know why that would have happened, but just for folks, the realities I just read, this definition that I read is on this slide here, and you're going to get these slides, and then now we're on this defining further. Everything else was just indicators for our stress opening. What we're trying to do is really focus on empowering persons that are experiencing a housing crisis to help them regain control of their own situations and lives. Again, thinking back to the stress of crisis and the lack of control people have when our brains are literally being rewired to sort of fight or to flight, and we don't have control over the way in which decisions are made or the way in which we can navigate. And it recognizes that homelessness is a crisis, and that if we can help people de-escalate that crisis by listening and validating those experiences, by approaching things in a non-judgmental manner, we center the client in our work by not bringing our own assumptions to the table. We are able then to create a partnership with our clients and the folks who are in a housing crisis that allow us to together help navigate toward some other solution. And this is the first step in what we call a progressive approach, which we'll talk about in a few minutes. But these are, again, probably looking at the slides now that you can see them, and I apologize you couldn't for a few minutes. These concepts are probably still fairly nebulous and fairly sort of all over the place in terms of, okay, we're trying to de-escalate, we're empowering people. And part of that is true in that housing problem solving is not defined by 3 or 4 eligible activities in a CoC grant. Housing problem solving is a way in which we interact with human beings that allow those human beings and empower those human beings to have control over their own lives, where our services and the interventions that we're offering are reflective of the desires and the goals of the client and not the other way around. Many programs across this country, and I would venture to guess some of the ones on the call right now, do a better job at creating program designs and rules and expectations that meet the needs of the program versus actually meeting the needs of the client. And so this idea of problem solving is flipping that switch to try to recenter ourselves around what those clients need, what those folks in crisis really need and want, and being able to adjust what we can do to support them, recognizing that even if somebody may need or want a long-term assistance or subsidy, that not being immediately available means we have to find some other way, some other common balance way and safe way to not have them living on the street or in shelter or in dangerous situations, at least in the immediate moment. So here's sort of a side-by-side juxtaposition. So before, the question would be, are you willing to enter shelter? Can we find you a motel? Can we get you a bed? Now we shift that focus. What can we do today to keep you from becoming or remaining homeless, even if for today? And part of this concept is that there may not always be permanency in the solutions that we are trying to navigate, but what we can do is relieve the immediate crisis and give people some breathing room in order for them to help navigate toward a more stable situation. The majority of people who become homeless in this country in a given year self-resolve their homelessness within 45 days. If we can help people self-resolve their homelessness in 1 day or 2 days, or not experience it 2 days from now, we're then cutting out the trauma and the ill effect and the longer term impact that homeless experience has on people, particularly on families with children as well. And we're able to then shift that narrative from trying to pull people in to homelessness and into trying to help people not become homeless at all. So rather than, what are we eligible for and how are we going to get you enrolled and here's your paperwork, we want to hear what would resolve your housing crisis. Instead of just immediately assessing people for all their vulnerabilities and asking them to divulge all of the negative things about their lives, we want to brainstorm and have these conversations with households that really try to understand what it is they need and how we can support a crisis resolution to avoid shelter entry or at least end it for a period of time. Again, that resolution may not be permanent, but at least we're continuing to reduce the number of days, the length of time, the amount of trauma that somebody in a housing crisis or at least homeless housing crisis is experiencing. So this is the paradigm shift, and this shift has been happening for a number of years. So HUD has published some things on housing problem solving. My VA and SSVF friends on the call call it by rapid resolution, which is a certain set of services. But it's a shift in perspective, and I think it's a shift in how we operate, especially in outreach and intake and walk-in settings, where we, of course, are always going to work our hardest to make sure people are safe tonight. And if there are no other alternatives, then we will make sure that people don't need to be outside, that they can be kept warm, that there's a bed available. And I know that's a challenge in of itself, but where we can find ways to help people navigate to some other option, even if a bit uncomfortable, but still safe and is not in that sort of crisis setting, then we're able to continue to work with them, either supporting them and they are able to then resolve because they stay with family or friends for a few weeks and they get back on their feet and they're off and running, or now they have that relationship they've built with the system or with you as a provider to then know where their options are, know where they can find assistance moving forward. But trying to shift our narrative from completing checklists and forms to really trying to focus in on what are the needs that the client has, what are the assets they have to them. So not why are you homeless today, but you've been housed for 10 years. How did you make that work, even when you were still facing poverty, right? So it's part of what I talked about in our coordinated entry training, focused on this idea of phased assessment, right? An assessment does not need to be a checklist or a form. Now, you will have checklists and forms as part of assessment, and there's new coordinated entry assessments that are being approved and have been reviewed by many of you within the COCs over the last number of weeks. And there will be a place for that. But this concept is the place where we're trying to connect to human beings as human beings and understand what are their goals, what are the opportunities and assets that exist within their lives, and how can we help them leverage and navigate those opportunities in a way that is productive toward their housing goals, while also realizing that if we don't do that, they either remain in homelessness until a bed is available. For some of these folks, that could be years before a PSH slot or even a rapid rehousing slot opens up, or they're able to self-resolve, but again, they're experiencing that trauma during the period while they're on the street. So housing problem solving fits into a number of different places, and it sort of recognizes this resource reality that I mentioned, that the number of people who are going to receive intense PSH support from you all and from the continuums within the state of New Hampshire is very small. The number of people who are going to receive rapid rehousing assistance is bigger than permanent supportive housing assistance, but it certainly isn't everybody. So there's this whole cohort of individuals and families out there for whom rapid rehousing assistance and particularly permanent supportive housing assistance is not going to be available at any time in the near to medium term future. And so what do? We have our options are to allow those folks to remain on the street or in their cars or in hotels that they're trying to pay for, to continue disruption in their employment or their mental health or their child's education, or for some of those folks, we may be able to help navigate some solutions, some ways that they can reconnect with family or friends, ways that we can mediate with their landlord to come up with repayment plans before they get evicted, ways in which we can identify people who may be willing to live together as roommates or in shared housing where alone they cannot afford to exit homelessness on their own and they're not going to be connected to other assistance or at least deep level assistance. But if you get two people that know each other, who have stayed together in the shelter or knew each other prior to or whatever it might be, their combined income allows them to rent a 2-bedroom apartment. We're now expanding that housing stock with those 2-bedroom apartments because we're not so focused on 1-bedroom apartments. There's a myriad of creative ways that we can help people resolve these problems. There's some other key terms that I want to touch on, though, before we get into some of sort of the mechanics of this. These are probably terms that many of you have heard: diversion, rapid exit, homelessness prevention, rapid resolution. I put this slide in here in its entirety so that folks would have reference to it. I'm not going to read it to you. But in a general sense, when we talk about these terms, diversion is when we're able to help people who are actively seeking assistance. They're looking for a bed. They're in crisis. They don't know where to go. They're in their car. They were evicted yesterday or kicked out of mom's house yesterday, or foster care moved them out when they were 18 years old. And they are looking for a crisis bed, a hotel, motel, an emergency shelter, a warming station. They're looking for help. Diversion is an outcome or a point in time when we're trying to help those folks avoid having to enter that shelter situation and instead find some other safe option. And I'm going to continue to use the word safe because this is not an absence or denial of services. It is trying to use a different type of service toward a different outcome that still remains safe and appropriate for that given household and based on their choices. But diversion, we think of as prior to the shelter entry, right as they're looking for crisis support. And we're trying to help them navigate towards something else. Rapid exit is the other side of the shelter door. This is trying to use these creative strategies, typically without a deep subsidy or a lot of financial assistance, to help people move away from their homeless situation and back into some other safe, appropriate, even if temporary housing option in the community or with their social networks, family or friends, or maybe where they came from before. But rapid exit and diversion are sort of outcomes on two sides of when somebody, by HUD's definition, for instance, becomes literally homeless. Homelessness prevention is further upstream. That is when somebody is facing the potential to become homeless within 15 or 20 or 30 days. And we are intervening at that point in time, trying to find a way to make sure that that doesn't happen. In some cases, that is mediation with the landlord, trying to come up with payment plans or other ways that we can do that, perhaps some financial assistance. In other cases, it is helping people navigate to another housing option before that housing option they're in now is no longer available to them. And then rapid resolution is sort of a combination of a number of these terms that is specific to the SSVF program. It's a term that the VA created to encompass both diversion and rapid exit type outcomes. So essentially, all of these outcomes or points in time rely on the use of creative housing problem-solving conversations, and the distinction between them is really about when we're able to help somebody resolve that crisis. Is it before they become homeless, but they're at the crisis door? Is it further upstream when they're anticipating facing homelessness in the near future? Or is it when they've already become homeless and we're trying to navigate them toward a safe option, even with very little financial resources where it's not available? So the reason I put this really dense slide up is for folks to reference. But oftentimes, I think in our work, we're going to refer to these interchangeably, and that's fine. We don't really care as much as what you call it, but we think it's important that you understand how we've made these distinctions. These distinctions are published right now in a VA tool. They also closely align with HUD's definitions of diversion and prevention, and they also generally align with the National Alliance and Homelessness use of these terms. And so we're trying to weave together some vocabulary here that all interrelate, but also have some important distinctions. And so you might run a project that you call a diversion program, and you are welcome to call it a diversion program. In my vocabulary, I don't think of diversion as a program. I think of it as a set of strategies that lead to an outcome that helps people avoid becoming literally homeless tonight, right? So those are nuanced distinctions. Many of you may not care about these distinctions, but I think they're important to have noted and important to have on slides. All kind of speaks to the fact that these sort of creative, mediated, sort of de-escalating approaches are system-wide. Whether somebody anticipates becoming homeless in 3 weeks and we're using our skill set to try to mediate a better outcome with the landlord, a repayment plan, and then a referral over to an employment support program that allows folks to increase their income, or whether that's somebody who recently entered shelter with no other options. They're in shelter and realizing they come in and they're expressing that there's nowhere else to go. But within a couple of days, the argument they had with their partner or their spouse, or they're recognizing that, you know what, it might be worth trying to talk to my brother across town or across the state, because he may be able to take me in, because this shelter situation is not what I want to be part of. Idea of problem-solving approaches applies to all points in the system. So it happens at that first point of contact, and many of you will see over the coming months with your coordinate entry process, we're actually trying to build breathing room into that first point of contact, so you all have some time to connect with people before you start putting vulnerability indexes in front of them and asking them how long they've been an alcoholic, right? We're trying to build in the breathing room for providers and for the system to connect with humans as humans and look for ways in which we can leverage essentially their strengths in a way that helps them navigate toward other solutions other than being homeless, right? So the other reality that we face with this is that we can be on the front end of folks who are coming in for crisis, the more we can reduce the inflow and the backlog pressure on the scarce resources on the other side of the coin. So many of you are working with people who have who you think need permanent supportive housing. And the reality you may see is that those folks are not going to get permanent supportive housing anytime in the near future. And so their option is going to be either to stay in shelter on the streets or in encampments while they wait, hopefully, for their name to move up the list based on the vulnerability of other folks and the relationship that their vulnerability and prioritization rests with other folks that are looking for assistance, or where possible, and again, it won't be possible with all folks, and it might only be possible at 10 or 15%, but where possible, what other options exist? And so, I think about that there's someone appropriate for diversion or for problem solving. And I think there's going to be a slide on this in a minute, so I might get ahead of myself. But I have a family member who has severe mental illness. He has schizophrenia, and he would quite easily elevate to a PSH prioritization if he were to go through the court entry process here in New Hampshire. Just because that statement is true does not mean that the other part of his story is also true, in that he is able to live with another family member. He pays that family member a modest amount monthly to live there, and he contributes to the household. And that family member is perfectly willing and fine having him stay in the house and to be supporting him until and if he moves on to his own place, or maybe gets a long-term voucher somewhere, or or something like that. So both of those statements can be true. Somebody may have a significant number of vulnerabilities that would lead us to thinking that they need permanent supportive housing, but also have natural family or social or community supports around them that can keep them out of the homeless crisis response system, reduce that person's name or story on our by name list and in our overall queue for housing. Somebody is unmuted, so I'm going to find you and mute you.
All set, Don.
Thanks, Stephanie. So that we can make sure that those who don't have those other alternatives are the ones that are going toward the more scarce resources. And I understand this is not one size fits all. It's not. It's utopian to think that all of the people who are in a housing crisis in our state and our COCs are going to have these alternative options. I understand, and we understand that many folks have already burned those bridges. Like my family member hasn't burned that bridge, and if he did, maybe he would end up in the system. But part of our reality is that if we don't have enough for everyone, we have to find ways to reduce that backlog pressure on these scarce resources and make sure that those scarce resources are going to those who have no other alternatives. I think similarly for a really just terrible trend we're seeing right now in this country around older people, elderly people who are becoming homeless, and because they're getting priced out of rental markets because their fixed incomes are not rising fast enough with rents. Landlords are not re-upping leases, and now you have 60, 70, 80-year-old folks that are facing homelessness and may not have other options. Well, they may have family willing to take them in while they are put on a list for vouchers for non-disabled elders or disabled elders, right? So there's all these other options that may or may not exist, but we don't know whether those options exist or not unless we explore them. And when somebody is in the stress of homelessness, the expectation that they're going to explore those options and be able to find fruit with those options without our assistance, without our support, without the empowerment that we can bring as a community, as systems, as individual practitioners and human beings and empathetic direct service case managers and outreach staff, it's an unrealistic expectation that folks in that type of stress during a pandemic, in the middle of winter in January, are going to be able to navigate their own options and assets and opportunities without the assistance that we have to provide in that service structure. So I think it's important that we frame this as a continuum of time within our system, and that housing problem solving, I'm actually going to skip this, applies to all of these different parts. So from the left side of the screen, we start with people who are engaging with community settings. We see that we're going along. There's this effort to divert them, to try to prevent them from becoming homeless. Some of those folks will be engaged with street outreach. Other will show up at shelter. Other will be recognized in the school systems. We're unable to divert them. We're bringing them into this coordinated entry process and making sure that there's an emergency shelter or emergency housing available to them. And then we are looking for what is the natural and available next step. That may be a rapid rehousing enrollment where we're providing short to medium term assistance with services. It could be that they're going to be targeted toward permanent supportive housing. But all along the way, we are continuing to use this sort of strange term problem solving or housing problem solving. We're continuing to have conversations with the client, with the household, about how we can support them in helping them to navigate towards something that is not being literally homeless, even if we cannot support them with, say, a long-term voucher or PSH slot at this time. And the conditions under which, or the conditions in someone's life may change over time. So just because our diversion effort failed doesn't mean that a few weeks later or months later or years later that there couldn't be other options that come up. You may have somebody who's been living in a tent for a number of years, is willing to try to work their way into housing, and not work by earn, but to get into housing, but still can't afford it and is not being prioritized currently for what we have available. But now they've met a couple of people in their community, in their sphere of or social life, whether those folks are in encampments or not, or in housing or family. And now they have this other support system they didn't have when we first talked to them 6 months ago. And maybe we can help them leverage that support system to get them into housing. And maybe that also means we're getting some other folks back into housing, or we're helping some other folks who are in housing who could use the financial help from a rent-paying roommate to keep that housing. And so we are recognizing that not all of these outcomes are going to be comfortable or ideal, but they may not be in homelessness. And so I think what this chart does is it tries to reinforce that while diversion and prevention and rapid exit are point-in-time outcomes, the notion of using problem-solving skill sets, which we're not going to get into today, we do full-day trainings with direct practitioners on that, but using these skill sets, these de-escalation techniques, this motivational interviewing, this mediation work, this ability to connect with family members and navigate and negotiate ways in which families and social networks can support each other. We use those at every point. This is just what we do. We don't say, okay, we're going to have our housing problem solving conversation now, and then we're going to move on to your enrollment. This is just a new or perhaps not new to you way of doing business. And for many of you, this may be the thing that you're already doing and we're calling it by another name. But part of the effort in New Hampshire and in many communities across the country is to memorialize and is to sort of document that we are active practitioners in this type of work, that we're not relying only on checklists to understand people's needs. We're relying on human beings to help understand human being needs, and that can happen at any point in somebody's crisis experience. So some of these example outcomes, and these are just very sort of simple ways, but somebody's coming in. Some of those outcomes may be that they're going to go back with family or friends long term. I was actually working with a community in Florida recently, and they were telling me a story about a veteran who got into not a physical, but just a disagreement with their spouse. Spouse kicked them out. I don't know the details on why that happened, but kicked them out, didn't know where to go, spent a couple nights in shelter. We're working with this, and the service provider was able to help sort of have a mediate a reconnection with that veteran, with their spouse, but also connect them to a basic referral. Didn't require any money, a basic referral to some family mediation services, right? So that person probably would have ended up going back home at some point, but we expedited that process because there was somebody willing to connect with them, willing to make that phone call or bring them over, sit down, have a conversation, and then make that referral over to a basic community resource that was available to them for further support. We also may see people that are new housing or relocating permanently to another safe place. And then where we don't divert somebody, we may see them going further down our court entry process. They're moving along in this phase assessment approach, and we're able to continue to support them in the ways that we are right now, to the best of our ability, with safety and then longer term housing options. So we may see a successful path where there's a point of contact with an outreach team or at a shelter. They go to, maybe they come into shelter for a day or two or even none, and we're able to reconnect them with family or friends. The person recognizes that they have family members across town or across the state. We help navigate that reconnection to that family member, negotiate perhaps a way in which that person may be able to stay with the family member for either a defined or undefined period of time. What would those expectations look like? Are there some commitments folks can make? Perhaps the family member taking them in is fine with them coming, but they can't, use alcohol in the house, or they need to be respectful of the children in the house, or there may be other negotiations that need to happen. Again, we do full day trainings on those things, and many of you, I'm sure, have done this before. But essentially, that reconnection and then that follow-up where we have the resources to do so. I think the important thing about this slide is that, one, many of this will look unsuccessful. Many people won't be diverted. Many people won't be rapidly exited. There are going to be a number of people that are going to continue to be in encampments and in our shelters, and that we're going to be pulling our hair out trying to connect to a housing resource. However, arguing, and the providers that I've worked with in different parts of the country that have done this really well have recognized that even when somebody can't be diverted or rapidly resolved, or we can't find an alternative for them other than through our more formal resources, we are still creating a different type of relationship with our clients that instills trust, that instills communication, that empowers them from the minute they engage with us, rather than disempowering them and asking them what went wrong to make them homeless, fill out this form so we can get you a bed. We're immediately validating their humanity, their strengths and their assets, and building a relationship that will continue into whatever comes next. And so when it comes down to that rapid rehousing referral, or that permanent supportive housing, or connecting with an EHV voucher or an SSVF program, we are now, from the very beginning, put the control in the hands of the client and allow that trust to build between our system or our program and the people we're trying to support. And that trust then manifests into better housing outcomes long term. So we're not telling people what to do anymore. We're not telling them to sober up so they can get in our programs. And I'm going to say out loud, because I think I'm allowed to, if you're running a program out there that requires people to be clean, sober, and medicated, then I think there's a lot of discussion to be had about whether or not those programs are effective in ending homelessness, right? So we're not dictating our programs to people or our system. We are working to empower people to help us navigate them within the confines that we have with our resources. So there's some core principles here, and I've gone over these around focusing on that empowerment, that listening. A little later, right before the end of this, I'll mention a couple things on staffing, because you also need to be able to orient staff not only in having the skill sets, but the time to do this. People need time to sit down with I guess pre or post COVID times or whatever, but with a cup of coffee and connect with human beings on that human level, and that's a skill set. But we kind of come at this with some of our core principles, one of which is really approaching everything from a strength-based approach. Most of the people who we encounter and who need our help have been told what's wrong with them for long periods of time, or for their whole life, or for this past week, or whatever it is. And our job is to make sure that we are acknowledging and standing up the strengths of clients as they're coming in for help, recognizing not that they're in a crisis now, but perhaps that they weren't in a crisis last week. So what worked then? Not recognizing or immediately going toward the fact that they need to go to recovery, but looking for ways that they've been able to navigate their addictions safely in the past, right? So thinking about that strength-based approach, which is, again, a staff skill set that we really want to be promoting throughout the state and as program managers and directors on the line. We also want to make sure that we are continuing to build our equity practice. And that means hiring staff that reflect the people being served, both in terms of their age and their race, their ethnicity, their gender identity, all of these different elements that make people who they are, that they may feel discrimination for. It's very difficult for us to say, for me, for Doug, who's a middle-aged white guy, there may be folks that I'm simply not going to be a good resource for in the community because they may not trust or be able to connect with my life experience. So thinking about how we build equity practices from our hiring processes to how we include and value the input from other groups in our decision-making process and how we orient ourselves, being able to change staffing so that if you have a female who has had sexual trauma or is a victim of domestic violence, that the people that we're connecting that female to are not going to re-traumatize her in our pursuit of trying to help with her housing crisis. Thinking about where we're not going. Is not a particularly diverse state, but we do know that disproportionately BIPOC populations in particular are overrepresented in our homeless systems. And that means that we're missing something in how we assist people, but also in how we outreach to them before they become homeless, how we make our services known before somebody falls into crisis, and how we support those families once they're in crisis. So thinking about how we adjust our practices to be more equitable. This is also part of the work that we've been doing with the state and the other COCs around court entry assessment tools and things like that, and there will be more to come there. And then really infusing these core principles that many of you have heard of: housing first, crisis response, choice, progressive assistance, and community resources. So, housing first, and really in some of this context, ensuring that there are low barrier options for people who need immediate crisis support. We are not looking to limit the types of housing supports that are available to people. We're not looking to deny people services. We're not looking to say, if you can't be diverted or if you have your family member across town, if you don't go to them, then we're not going to help you. Our focus is on making sure that the balance between the resources we have available and the people who need those resources is as balanced as possible. And right now it's completely unbalanced. And so problem solving is a housing first approach, and that we are continuing to pursue housing for everybody, regardless of the barriers that they face or the barriers that we perceive of them facing, and making sure that our efforts are not being limited by that, making sure that just because somebody has no income or no income or is actively using substances or has a criminal history, that we're not pushing them away from services. And in fact, as many of you have seen in the new court entry tools that have been worked on over the last number of months, we're actively and proactively pulling people with those more significant barriers into the longer term supports, because it is those people who need those longer term supports the most. So problem solving, there's been criticism early on that it was a denial of services. And what I want to reinforce is that it's not a denial of service. And in fact, it is part of a housing first system approach that continues to focus everything we do on moving people toward permanent or long-term housing, and recognizing that folks may have other goals or challenges in their lives that we're not going to be able to fix, but we can focus on their housing. It also is, as I said before, again, the core principles, a crisis resolution approach where we're de-escalating that stress, that emotional stress on folks' lives, and trying to work with them to define ways and steps that we can take with them as a partner in this toward helping them regain control over their lives and ultimately their housing situation. That then rests on that client choice, making sure that the goals that the client has and the choices and preferences are respected. There should be the ability for someone to say no, even though they have family members in one place. They may not want to go to that place, and that is perfectly fine. We do not want to create unsafe situations. We do not want to create other pursuits that are not agreeable to the client. Also, seeing the chat light up a little bit, Stephanie, so pause me after this if I should respond. We're also grounding this in this idea of progressive assistance, where people's needs, we recognize people's needs change over time, that cookie cutter services will not work, and that oftentimes we have to start with a lighter touch service package before we're able to offer something more in depth or deeper or more intense. And where we can offer that lighter service package is within this context of problem solving, mediation, and navigation toward other options. And then where those other options, where that navigation either doesn't exist or fails, we continue to work toward those more deeper subsidy or longer term service packages that are associated, say, with PSH or rapid rehousing. I put this slide in here just as a reference for a future reading. I'm sure everybody will be excited to read it. But essentially, when we talk about this idea of progressive assistance, we're recognizing that it's nearly impossible to predict the level of assistance a household may need to end their homelessness. There may be some people with significant vulnerabilities or perceived vulnerabilities for whom there are options for them to exit or avoid homelessness altogether with very little support. There may be people who on a vulnerability assessment look like they won't need much, but in fact, they need a much deeper service package in order to stabilize. And so progressive assistance basically promotes the idea that we start with an as-need light touch service package, and then as those service packages prove not to be enough for that particular client or situation, we escalate our services to a deeper level of service over time so we can find the right balance and preserve those deeper resources for those for those who really do need them. And maybe needing them is the wrong term. There are a lot of people who need our support, but whether or not it's available is another discussion. So we want to preserve those who may need them most or be most susceptible to either permanent homelessness or death or injury or further trauma should they remain homeless. And then finally, this coordination with community resources. And I actually think, in what I've seen in New Hampshire, this is done really well in this state compared to some other states that I've worked in. But we need to be able to know what are all of those different resources that are not connected to homelessness, like that family mediation example from the veteran in Florida. What else is in our community that just support people in the community, or people perhaps in poverty in the community, or people with children in the community, whatever it may be? How do we make sure that we have a pretty good idea of what's available, and then where we can recognize that those types of mainstream community-based resources and support systems can be leveraged or be referred to be able to move people toward those, and not necessarily assume we have to pull people into our services to provide support when we may have natural support systems outside of the finite homeless resources that we can control. I'm going to stop for a second. Stephanie, is there anything that I need to talk about in chat, or should I keep going?
We have just one question, and I let Susan know we could address it later, but I'm happy to read it off right now if you'd rather address it now. I think it could. Yeah,
let's do it now, and that'll give me a chance to have a sip of water while I look at it.
So Susan says, I feel like there are a lot of programs out there for the ones that are able to find an apartment, but what about the ones that we could get them in to stay with family if there was some financial assistance for them?
Yeah, so that's a great question, Susan. There's a couple of, this is where I think we have to figure out how, sometimes we have to figure out what our funding allows us to do and doesn't. So for SSVF, on the VA side, there's an example of this where with certain commitments from, well, I'll call it a host family. I don't love that term, but don't hate me for it. Just a host family, a family member will take somebody in, but they need that financial assistance. In SSVF, for the VA programs, there is the capacity to provide some limited financial assistance to veterans and their families when the family makes a certain commitment of time the veteran can stay with them. and that also results in an enrollment in the program for further support later. In other communities, maybe other ways to get around that. So for instance, in ESG and CoC rapid rehousing, you can't provide financial assistance if somebody is not on a lease, but if somebody was homeless, enrolled in one of those projects, and then is able to navigate back to a family member and is added to their lease, there could be financial assistance in that type of a setup. There's also a lot of communities that are looking for either federal or state flexible funds, and I would defer to the state partners on this because I don't know the current status of this in New Hampshire, where they do have sort of dedicated, they call them diversion resources, but problem-solving resources that are more flexible in nature and say could pay mom a couple $100s a month for a few months while Doug lives with mom. And then there's the mediation piece that I think is probably more, it's probably harder to do, but it's probably more prevalent just given the resource constraints. And that is where if I have some income, the provider could work with me and my mom to come up with an agreement about me contributing into the household, right? So maybe I'm receiving either disability income or I've got a job, and I'm going to contribute X dollars a month toward the household's needs. And there's an agreement, a mediated agreement, perhaps in some cases, between me and my mom, kind of facilitated by a service provider or a referral place that says, okay, here are the consequences if this doesn't happen. Here's what it does if it does. So there are some federal and state funds in the world that support financial assistance for folks that are not going into a lease. Other financial assistance packages that may be require that lease, and then some of it is flex funds or more of those creative pieces. In Cleveland, Ohio, where the Cleveland Mediation Center is, which was sort of one of the early pioneers of this type of work, they didn't call it this at the time, but even back in the early 2000s, they were doing some data runs, and they recognized that by training their staff in these types of concepts, they were able to breed better outcomes in terms of diversion efforts, often without financial assistance. And they were seeing, and I'll misquote, but generally, they were seeing 20 to 30% of those households that were looking for a shelter bed or coming into a drop-in center for help were able to be diverted, and very, very few of those households required much financial assistance, if at all. And they have credited their staff, their training, and the way in which they've sort of instilled and embedded this concept in this way, this sort of mode of operating within their community. And they've embedded that over time. They've practiced it. They work together. They have role playing internally around how you might help navigate people in different situations. So financial assistance is of course important, but it may not always be critical. And I'm seeing a little bit more on that. I'm going to continue. We'll come back to that. I want to get through the slides. Excuse me. And I only have a couple slides left, just to say that out loud. I was hoping to leave more time for the chat. So as you are seeing these last couple, please add things into the chat. And I would also, given we've got about 20 minutes left, welcome anybody to come onto the phone. So I mentioned earlier that one of the things, so we do multi-day trainings on this. And one of the things that is clear is that type of work can happen without training and support and really taking a look at the kind of the day-to-day life of your projects, and especially those outreach, intake, and shelter projects, and how they interact with clients. And I want to just pause a moment and say that while I'm sort of like new way of thinking, it's not a new way of thinking for one. Many of you are already doing this. And two, pending that the day-to-day life of shelter staff has all sorts of extra time at hand to go have a cup of coffee with somebody, to dig into their personal histories and get to know them and create this like deep human experience, right? These are very difficult times we're in, both with COVID, with the lack of resources for at the shelter level. We have a lot of people coming in. Right now I live in Manchester. It's 20 degrees outside. There's a lot of emergency problems happening at the moment, and so the idea that we're just going to reallocate staff time away from data entry and into this idea of kind of this mediated, empowered kind of conflict de-escalation modality, I understand to be sort of utopian, but I think we can do it over time. And one of the things that we look at different systems is, how do you staff this? Who do you train to do this work really well? Because it takes training and practice to do it really well. I, for one, would not be particularly good at this directly with clients. I am not as patient as others might need to be to do this really effectively in the world. So while I've studied and understand programs and communities and people and systems that do this really well, if you put me with a client, I don't think that I would succeed in this job or this role. And I think that's important to recognize, that this job or this role may look different for the future than it looks like right now. And that requires that training and that support. And it also requires decisions. Do we train every person who's going to engage with people who are on the street or in shelter in these types of skills? Or do we train a couple of people and have more specialists? Or do we do both? Do we have specialists that also support people, right, in how they do that, right? So there's different ways to think about that. I think, generally speaking, given the number of assessment points there are in the state of New Hampshire, a broad-based training regimen is probably more appropriate, because you're going to have a lot of people engaging with other people. And so making sure that you have the capacity across those assessors to be able to provide this type of service, or to approach their service in this way, is really important. And that will be embedded into that coordinated entry process. So as we look at specialization, thinking about the ways in which we use the limited professional development time we have, our hiring strategies combined with those equity strategies that I mentioned earlier in terms of who we hire is really important. One of the things that we discovered when we rolled out the SSVF rapid resolution work, which I was part of the team that built that a couple of years ago, was that former clients, folks that had been homeless, had been through the system, were now in housing, were some of the best rapid resolution or diversion or problem-solving specialists that we could find, because there was an immediate intimate connection between their life experience and the life experience of the folks who they were working with. So before this past year or two, when so much focus has been on equity, and we've learned through that focus that part of our equity focus and our commitment to equity is hiring people who look like and have had similar experiences to the people that we're trying to assist. That then gravitates toward hiring former clients or people who have had lived experience in homelessness. Not only hiring them, but frankly helping them design our programs, because they're the ones who know best on how our programs fail them. Looking for ways that we can position staff either in any combination of this, whether everybody's trained or you've got specialists or inflow points where you want to pilot this. Maybe in your community, you're covering an entire county or part of the state, or RAP, I guess it is, regional access point. And maybe there's all sorts of places where folks are first engaged. But what you want to do is say, okay, in Nashua, this is the particular shelter or location where we're seeing the most inflow, or the people who we really need to connect with the most. We're going to put our specialists, our time, our effort, our problem-solving skills to the test in this place first, and we're going to allow that then to branch out into the broader community. That decision for Nashua or for Manchester will look different than way up north, or in Laconia, or in Portsmouth, or in Greenfield, or wherever we are, in Londonderry, right? Because homelessness is in every town in the state, despite what maybe some of your mayors and city councilors believe. And so thinking about your own organization and your position within this broader goal of ending homelessness and your staff, are there folks in your team who on this call that really would benefit from like a deeper kind of dive into these concepts? And we don't have a direct service training set up right now or anything. There's a lot of resources out there on this, some of which are webinar format, some are reading format. There's some learning management system work that's happening for the VA side that we're working on that can help people build those skill sets and allow them to infuse this not so much as, okay, now you're a problem-solving person, but this is just how we do business. We don't approach people as checklists. We don't just immediately tell people to go find a bed. What we do is make sure they're safe for the moment, but we try to engage with people, and we try to get more creative, or as creative as we can be about connecting people back into housing. And just to repeat what I said at the very beginning, we are not going to end homelessness with one-bedroom apartments. We are not going to end homelessness with everybody living by themselves. we are not going to end homelessness by giving everybody a PSH slot. So our options are, we either only end homelessness for those for whom we can connect to one-bedroom apartment or PSH slot or maybe a rapid rehousing enrollment, and then everybody else lingers until we can get to them. Or we find ways to infuse more creative strategies, more nuanced strategies, more, in some cases, harder strategies, right? And, you know, roommates and shared housing are not easy, right? Connecting people who never lived together before to live together is not easy. We see that in college dorms all the time, right? But most people live with other people. I live with someone, she happens to be my wife, but without our combined income, we wouldn't live where we live. And that's the reality of our housing market. If we want to fix our housing market and we want to go build housing, then that's a admirable role we have or need we have in this country, but that's not the role that many of you play. Many of you do not have that mission in your mission statement, the money to do that. What we do have is we have really dedicated people, right? The people power within our organizations to find more creative options that can support clients and folks who are in crisis, helping them de-escalate that, re-empowering their lives, because so much about homelessness is disempowering, right? It's pushing people down, it's going toward the negative, bringing back the assets and opportunities that people have in their lives, cultivating those assets and opportunities, and helping people navigate toward them. And that requires skills, that requires training, it requires support, it requires management support, it requires our ability to look at our physical spaces and our virtual spaces in a way that allows for those types of conversations and creative decisions to unfold. And it means that we're never going to be perfect, and that our endeavor to end homelessness is only perfect when there is no more homelessness. And until that time, we want to make sure that the good we can do, the better we can do, slowly, one client at a time if need be. If only 10% of the people that we engage in this strategy, if we engage everybody that we see in this strategy, only 10% are actually diverted or their homeless crisis ended earlier. Some may call that a failure. By most HMIS systems, you see 10% success in something, it's a failure. I would call that a great success, because that's 10 fewer people or 10% fewer people who are on the street tonight, who are struggling tonight, who may die tonight due to their homeless situation. So it's something for future consideration. And I somehow found it well to end where I was hoping to leave about 15 minutes of time for either questions or comments in the chat. And I'm just going to open that up now and pause a moment. And then Stephanie or others from the state who have been part of this effort, if there's anything you'd like to add, would welcome anything that you have.
Doug, I'm getting a few comments in the chat sent privately that I just wanted to, it reminded me a good opportunity to just voice that, you know, we understand and support you all during these times. You know, the pandemic has really complicated a lot of our efforts and programming and has put a lot of stress under everyone. I think Doug opened at the beginning saying, you know, think of a time when you've been very stressed out and in that kind of mode. You hit the nail on the head for a lot of us, you know, during the pandemic has been one of those very stressful times. And that does not go unnoticed here. And we appreciate all the hard work that everybody is doing. And know that, you know, this training and conversation and the whole series is meant to be supportive, nothing punitive. And again, you know, we see the hard work going on. I think everyone here is doing a really great job already with these conversations. And I think it's still important that we have these ongoing conversations and reminders of what some of this work looks like. And we're here to support you as much as we can. So I just wanted to add that. And I did want to mention there was a question in the chat about a follow-up survey after this training. Doug, I know we haven't done any follow-up surveys yet after the first 2 sessions we've done, but I'm happy to put one together following this section just to hear any feedback or you know, other asks or questions.
Yeah, we're happy to put one together if you all want. Also happy to take feedback, you know, directly if that's the purpose of the survey. You know, you could send myself or Stephanie or throw it privately in the chat. And just to reinforce, I know I've mentioned a couple of things around, know what we are and are not doing. I am acutely aware of how difficult everything is right now and how hard your teams are working. And I would venture to guess that a lot of what we just reviewed are things that you've already been doing or that have been strained because of COVID, or maybe you did it because of COVID and there was no other option to help people navigate. And what we're doing is putting words around that and trying to create a common sort of set of foundational understandings for everybody to explore these types of ideas. But there are hard realities moving forward in terms of the lack of affordable housing that we have, or the lack of units that are out there. The income to rent gap is continuing to grow, and so the part of this, training and some of the comments that I made, it's really about just reinforcing the need for this creativity in order for us to be able to accomplish the mission of ending homelessness, because I don't see how we do it otherwise. And that does not imply then that folks aren't creative or that you're not working hard or anything like that. So just want to clarify that. I didn't see any of the private chats, but just for my own reference.
There weren't any other questions in the chat. Again, I think Doug already mentioned, but you're welcome to come off mute if you have anything you want to ask or add. And the chat is open for anyone who wants to utilize that function.
Well, I would welcome and encourage other folks' feedback or questions. Like I said, we weren't getting too much specific into New Hampshire's core entry process, but some of the elements of what we just reviewed are continuing to be embedded into the actual systems that are being designed and redesigned and reworked, both from the the prevention and diversion tool that's out there now to some of the changes to the coordinated entry assessment. There will be continued deliberate effort to capture or to promote these types of practices throughout the state, and I think this is sort of an introduction to that, and there's more to come. And let's see. So Jim, you asked, will we review the checklist at some point? So there are problem-solving piece. That is more the conversation, but there is the coordinated assessment tools that have been, I believe, voted in by the 3 CoCs that are now being prepared for distribution and training. That's maybe what you're referring to, Jim. I'll let Stephanie expand on the timing for that. I think there are still some schedules to be worked out in terms of that rollout, but I'll defer to you, Stephanie.
Yes, we're going to do the full training that was on the schedule. We just need to get those back on the schedule. Doug and I had to revisit the training schedule due to the timeline with ICA and the new HMIS system rolling out and all of that. So we will be reviewing the assessments and that whole process and the actual tools and the upcoming training. Hopefully we'll know by the end of this week what the schedule will be. I'll send it out to everyone like we've been doing.
All right. Well, I really appreciate all of you coming today. Went a couple minutes early here, which is cool. Let us know any other feedback you have. And again, I work in different parts of the country, and I'm always really honored to be working in my home state, hometown. I am a New Hampshire kid and raising my kids here now, which is exciting. And it's nice to be connected with folks that are local. So really appreciate your work. I see it every day in my own life here, and I know all of you have been impacted just like everybody has with COVID and with the affordable housing crisis. So really appreciate your time. I look forward to reconnecting with many of you in the future, either in these types of engagements or hopefully things that are a little bit more conversational. And Stephanie, I don't know if you have anything last you want to say, but we can close out.
Thank you, Doug, for putting this together and running it. And thank you everyone for attending. We'll see you soon.